And the bottom line is, today we saw the Republicans run the same play and they got the same result. The question is, will they change course? The votes aren't there. It's clear from today's vote and yesterday and 2 days ago's vote and the two other votes before it. So the bottom line is we've had 4 votes and they haven't gotten the votes on any of them. We have asked Republican leaders for months to sit down and talk with us. They've refused and barreled us into a shutdown. They thought they could bludgeon us and threaten us and scare us. It ain't working because my caucus and Democrats are adamant that we must protect the health care of the American people. And so now, rather than working with us to end the pain Americans are feeling because of a shutdown, Republicans have instead, they've wasted a week, refused to talk, and exacerbated pain for America. Instead of trying to come to the table and negotiate with Democrats and reopen the government, the White House and fellow Republicans have vowed to make this a maximum pain shutdown, they call it. Unfortunately, the maximum pain falls on the American people, and the American people know it. They know it's not Democrats doing this maximum pain. It's vote and Trump and the Republicans. And so it falls on them. And so even in the White House and in the administration, there are people saying, don't do it, because the blame correctly will fall on Trump's shoulders. They're using the American people as political pawns. Why? Because they don't want to even talk to us about reopening the government by fixing health care. New data came out today from KFF. And that is not Kentucky Fried French fries. KFF could be Kentucky French fries. Nah.
Kaiser family.
I know. Orange. Excuse me. Today, new data came out from KFF, the Kaiser Family Foundation, that said that 78% of Americans say Congress should extend the ACA tax credits. 60% of people who voted for Trump said extend the tax credits. And so the Trump administration is feeling it. They know there's trouble. And let me read you a headline from this morning's Wall Street Journal that I thought was very apt and very well written. Raise your hand if any of you wrote it. You get kudos. It says, White House senses political risk on health care despite shutdown bravado. They know that the American people are for it. They know that 60% of MAGA supporters are for it. And why? Well, because if these credits are not extended, listen to this, the average couple who's 55, the average 55-year-old couple making $85,000 a year would see their premiums not just double, but go up $25,000. You're a couple at 55, you're about to think of your retirement. How the hell are you going to find $25,000 a year for your health care? Do you know what anguish that causes people? It's not just something that goes away. People sit there and agonize. How are they going to get health care, which they need so much? What are they going to cut? Republicans hold the House, the Senate, and the White House. They're in charge. American people know that. And the American people know that it's only smart and fair and right that they should negotiate with us if they want our votes, not do a partisan bill. They wrote it all with no Democratic input and say, just vote for it, take it or leave it. According to NBC today, Americans are more inclined to blame Trump and Republicans for a shutdown, according to 4 independent polls. Any of you NBC people wrote that headline? It's a good one. Republicans know it. They know the damage they're causing, and Americans are noticing. And what's their response? A vow to cause maximum damage. That maximum damage is to American families, and American families know it. What's their response? When they didn't get the votes today or 3 times before? We'll see. Maybe they'll have a change of course. That would be a very good thing if they came and sat down and negotiated with us. And their second response is to just lie. They're so afraid of the truth that they make up lies. Here's PolitiFact when they say, oh, the Democrats want to give the money to undocumented immigrants. Here's PolitiFact. J.D. Vance said, Democrats are threatening to shut down the entire government because they want to give hundreds of billions of dollars to health care to benefit illegal aliens. What does PolitiFact say? False. And I hope you'll all write that over and over again, because if they're going to tell the lie over and over and over again, it's the responsibility of all of us to say it's a lie over and over and over again. Undocumented people cannot and will not receive a premium tax credit by federal law. The federal government does not fund health insurance for undocumented immigrants in Medicaid, Medicare, or Social Security by law. Republicans know it. They lie about it. When I was with the White House with Johnson, he said it. I was sitting there. I said, that's bull. And he didn't say it isn't. He just smirked. That's what they do. And when you lie about it, it shows fundamental weakness, because you know where the American people are. When they're confronted with the truth, they cover it up with a lie. But unfortunately for them, the truth doesn't lie. And as I mentioned, this chart shows what a high percentage of Americans want us to extend the ACA subsidies for health insurance. 71 to 29. And it shows you that's why it's so high, because even 60% of Trump voters want to extend it. So Americans want lower costs. Americans want to extend the tax cuts. Many of my Republican colleagues want that too. So it's simple. They can reopen the government and make people's health care more affordable at the same time. And the only people making it a choice between one and the other, between health care and opening up the government, to the Republicans. We're not. We say we can do both. Senator Klobuchar.
So what's at stake here? The Republicans have created a health care crisis. It was already a difficult situation, but by passing the big, beautiful betrayal of a bill, they basically are kicking 15 million people off of their health care, off of Medicaid. They are going to close down rural hospitals. Some of that already has happened, in part because of the $500 billion Medicare cut that was triggered because of their decision to increase the debt so much with tax cuts to the wealthy. Those are things that have happened. But the final thing is that when it comes to the Affordable Care Act, where you have 20 million people that are on these plans in each of their individual states, in my state it's called MNsure, they will not be able to afford their insurance. I heard this big time when I was out in rural Minnesota. I went to 13 counties last week. Time and time again, the farmers, over a quarter of them are on these plans, even higher in my state. And they told me, we can't afford it. It's going to double our premiums. One guy said it's like a perfect storm of ugly between the Republican tariffs and the healthcare costs and what's happening with their input costs like fertilizer because of the tariffs that have been put on those. That's what's happening right now. And what does the president do? $20 billion to Argentina, while our soybean farmers have literally had their entire market dry up. So what else has he done in response to our serious request to have negotiations? He posts a deepfake video with sombreros in it, and he thinks that's funny. This isn't funny to the American people who are starting to get their premium bills right now. Then today it's the Grim Reaper with himself in a video that is just, again, completely, he thinks this is funny. He thinks that people are going to joke about this. I promise you, they're not. They are seeing their premiums double right now. So why is this something we're standing up for now? Because it's happening now. Ask anyone you know. It is not a December thing. It is not a January thing. It is a now thing. And we are asking them to meet with us to do something to help fix this healthcare crisis. And it's something they can do. It's something I am sure many of you have heard them behind closed doors say they actually want to do, because they've realized so many of their rural constituents. And when you look at the number, you realize so many Republican constituents know that this is a plans that are relied on by small businesses, by individual farmers, by people that don't work at big corporations so they can't afford their own health care. That's what happens. And I just cannot believe that they've decided instead to repost offensive deepfake videos than actually get to work, open the government, and do something about health care.
Thank you, Senator Klobuchar. Senator Schatz.
Somebody sent me the notification that the House is not planning on coming back next week, and I think there is not a clear illustration of their lack of seriousness in terms of reopening the government and solving the healthcare crisis. And there are a lot of people asking us, why now? And the answer is, the crisis is now. People are getting their letters now. The price spikes 114% for 24 million Americans. They're happening now. And so in the four corners of the Capitol, this is being treated as a kind of political question and a procedural question and a kind of public relations question. But for tens of millions of Americans, people on the exchanges, but also everybody else, because we know how health insurance works. When people lose their health insurance, everybody else who retains their health insurance sees a spike in their rates as well. Tens of millions of Americans are actually getting hurt, and this is not an abstraction or something that we're going to argue about that may or may not happen 18 months from now or 24 months from now or 3 or 4 years from now. They're getting the letters now, and some of those letters say, we're not sure how much your increase is going to be, but we'll let you know later. And some of those are pretty explicit. You were paying $289, now you're paying $485. And so this is serious business. And if you look at Leader Schumer and Senator Klobuchar and a lot of our leadership, we are perfectly willing and capable to do bipartisan compromises when it's in the interest of the public. But we need a dance partner. We are sitting here saying we are willing to solve this problem with you because this is hurting your constituents too. But you have to sit down and work with us to solve this urgent healthcare crisis.
Senator, thank you, Senator Schatz. Yes.
I asked Mr. Johnson this morning about what he's willing to do to make sure premiums don't spike for Americans. And he said, quote, we are committed and will do whatever it is necessary to make it happen. So my question to you is, short of your bill, what commitments do you need to see?
Look, I'm not going to negotiate in public. As I said, we need to protect Americans from these rising insurance rates. And we need to sit down and negotiate it. He won't even do that. So how can he say he wants to help Americans if he won't sit down? He knows he needs both sides to get it done, plain and simple. In the White House the other day, he said he didn't want to do any ACA. And he said that before in the past as well. But the American people are going to make it clear to him and certainly his members that they want it done. And I believe that they will be pushed very hard by American citizens who don't want to see their rates go up so much.
There are some informal talks going on between senator and senator. How dialed into these talks are you? Do you think they're making any progress?
Yeah, look, first my Democratic senators who were involved came to me, a bunch of them, and said, should they do it? I said, by all means. We want Democrats to talk with Republicans. And so it's a good thing. Unfortunately, last night, if you ask our Democratic senators, the Republicans didn't offer anything really new. Just the same old stuff. And so nothing on ACA, nothing on rescissions. And so, look, our Democrats want to go back and negotiate again, but they got to negotiate with something, get something in return. Yes.
Whatever bill that you support to open the government, does that have to include language specifically addressing the ACA crisis? And secondly, you mentioned that President Trump at the White House meeting was open, perhaps, to extending these subsidies. At least he was sympathetic. He said he heard about it for the first time. Have you tried to reach out to him again to kind of keep that conversation going?
Well, look, the bottom line on that is we need the president to be involved. Johnson and a whole lot of his caucus don't like the ACA. don't want to do the extensions. A lot of Republican senators in the Senate do, but they're not enough. Thune is not enough. You need Johnson, and you particularly need Trump to get it done. So that's the bottom line, and we need real improvements in Americans' health care, plain and simple. Calling someone in the back. Way in the back. Yep, go ahead.
Leader Schumer, it was reported that there was a 34% increase in demand at the Military Food Bank in Fort Worth, Texas this week. How do you square the needs of constituents facing immediate pain during a shutdown with your focus on lowering healthcare premiums?
The bottom line is there's a simple way to end the shutdown. Come and sit down and negotiate a fair bill with us. Yes.
The president, as you say, has been tweeting out memes. Democrats have said that he doesn't understand this healthcare crisis. What makes you think, what evidence do you have that he will eventually be bowed to public pressure?
The evidence we have is right here. 60%, or 58, I think it is actually, of Trump voters want it extended. And it's going to, the pressure on the president to do the right thing here will get greater in the months, as both Amy and Brian mentioned, as people get their new health care bills, and they see how much it is. It's shocking how much it is. And they go and say, who did it? And we Democrats are going to be there day in and day out and say, the president and the Republicans did it. And that's why we feel that's why we feel we're in a strong position. Thank you, everybody.